It's Megan and Jillian. We are again quality safety educators over at main campus. We're going to go over deaccessing a port, reaccessing a port, and the dressing change for a Mediport. You want to, again, do this every 7 days. Again, on main campus, we typically do it on Tuesdays and Wednesdays, but do what's right for your facility. And of course, change it earlier if you notice that the dressing's not occlusive on your assessment, it's draining, things like that. So we'll go ahead and get started. You want to make sure that you have your Mediport kit. You also want a saline syringe and a cap. You want to ask the patient before you begin, what size needle do they use? Are they able to draw back blood from their port typically? We use that for placement purposes. You know, we'll aspirate before we dress the actual Mediport. And if it doesn't aspirate, we kind of question it. So we want to make sure that we know for sure that they typically can get blood back.
You also want to make sure too, whenever you're assessing your port, you want to make sure that they have the blue bio patch in there. If that's something that's not there, then that would be a reason to also, redress and to deaccess and reaccess the port. So we can go ahead and get started. I'm going to be non-sterile, clean in this portion, and Megan's going to be sterile. We again recommend that you use a two-person approach. And so we'll get started. You're going to ask the questions like what Megan went over, what size needle, if they're able to aspirate or not. And once we know that stuff, we'll start by taking off the dressing. So we kind of just go all the way around. This tegaderm is just sticky on the end portions. So we'll take that off. Then we're going to want to stabilize the skin, and you're going to want to pull straight up. It has the little safety clamp, and then you can throw this away in the sharps container.
Okay, so we'll begin with reaccessing the port. You're going to have your kit that we're going to go ahead and open up. This is just a drape. So like in the central line kits, the top part of your kit is going to be non-sterile. So again, we're going to make sure that the patient has a mask on. Everybody in the room has a mask on as well. I'm going to perform my hand hygiene before I put my sterile gloves on and get access to the kit.
So while Megan's doing all that, you're going to have your flush and you're going to have the connector. We're going to have the correct size needle. If they don't know what needle size they typically use, whenever it's deaccessed, you'll be able to see. We're going to go ahead and we're going to open that. Just so the corner part is exposed, we want to keep this all sterile. Take that off. And then we're going to want to go ahead and we're going to prime this. So we prime this. And then I can kind of just hold on to this and Megan can get started.
All right, so you're going to take your ChloraPrep, you're going to pop your ChloraPrep. And same like with the central line dressing changes and PICC line dressing changes, you're going to use a hashtag motion. Again, warning the patient, if we breeze over that opening where his port was, it's going to burn. But we're going to do this for 30 seconds. Okay, we're going to make sure that that is visibly dry before we attempt to reaccess.
So I'm going to make sure I'm only touching the syringe part of this, okay? We don't want to touch anything else that would be sterile. When I'm handing this over to Megan, I can grab the little part that's over the needle and she's going to be able to pull off.
Okay, so at this point, again, I'm going to feel around for the port. Every port's a little bit different. Some have the dots that will locate your port for you and where your drum is, but we want to make sure that we are stabilizing the port before we access. You're gonna go in at a 90-degree angle. So once I think I got my port, I'm gonna stick straight down. All right, I think that I'm in, so Jill can touch the,
And normally I would be on the other side of Megan, but I'm gonna have the flush, and this is the same as for the central line dressing. We're gonna wanna use a pulsating flush. And then we're gonna wanna aspirate. And we are getting blood return, so we can go ahead and flush again. And then at that point, we know that we're in where we need to be.
Absolutely. So these kits do have the blue BioPatch. You want to make sure that the blue part is up. And we're going to kind of put this around our needle.
And that again is just really important to help prevent infection, so we want to make sure that that's always there.
All right. There is a little clip here for where you were holding on. We can take that off. Then we're going to use our skin barrier. And we're going to go around where all the tape would be to help protect their skin. It also helps the dressing stay occlusive because it adheres to it. All right. Then we're going to put our dressing on. You do have a little notch here. You want to make sure that your pigtail is kind of hanging out of that notch. Do you mind moving the pigtail out a little bit for me? Thank you. All right, we'll press that all the way down. Again, making sure we're as flat as possible. Label to your friend. And these also have what we call the pants. Again, it's to help kind of put on the other side to make it as occlusive as possible. And then we'll put our label on there.
Again, you want to make sure you have Kuros caps. We're going to put the caps on the ends. And then you can just ask the patient what their preference is as for taping. Some people like to kind of just leave it hanging down. Some people like it taped around. Just ask them what their preference is, and you can tape it like that. And that is it for changing a Mediport.